With that, I'm very pleased to welcome Dr. Paul Roumeliotis. Dr. Paul is a pediatrician and has been the Medical Officer of Health and Chief Executive Officer of the Eastern Ontario Health Unit since 2007. He is past president of the Association of Local Public Health Agencies and currently sits on several provincial committees and boards, including the Ontario Provincial Council for Maternal and Child Health and United Way East Ontario. We are also privileged to have him as the chair of the Board of Families Canada. Certified by the American Board of Pediatrics and the Royal College of Physicians of Canada, Dr. Paul has a first-class honors Bachelor's of Science degree in microbiology and immunology and a medical degree at McGill University. He also holds a Master of Public Health degree from the Johns Hopkins School of Public Health, where he is an associate faculty member and is an adjunct professor at the School of Epidemiology and Public Health, University of Ottawa. A passionate supporter of early child development through the life course and social determinants of health lens, he believes that public health is what a community collectively does to ensure the health and wellness of its population. Dr. Paul and his EOHU team coordinate and continue to lead the local response to the COVID pandemic. And as a passionate advocate for immunization, Dr. Paul is involved in several national projects that address vaccine hesitancy. Thank you so much for joining us today, Dr. Paul. We will begin the discussion with some questions we've received from the audience during the registration process. And as a reminder to the audience, please feel free to post any questions or comments that you have and to use the raise hand button. So Dr. Paul, if you're ready, we have some questions that people had sent to us earlier as they registered. And one of the first questions we have is, how can we provide confidence that there won't be reactions to the vaccination?
Vaccines have been around for many years. The mRNA technology for COVID vaccines has been around for a while. And all these vaccines have gone through very rigorous testing and both pre-release and post-launch. And so we are continuing to monitor them. Billions of doses have been given specifically with COVID and multi-billions with other vaccines that we use in the pediatric age group with very little serious side effects. And so I think that speaks for itself. Again, the COVID vaccine was unprecedented in how quickly it was turned out, but it had to do with the fact that we were in a worldwide emergency, and really many academic and commercial entities worked together in an unprecedented speed, but it did not sacrifice the effectiveness and the safety and efficacy studies that Health Canada has done. And so, we've delivered, like I said, in my health unit, almost 750,000 vaccines to our population, billions in Canada, billions across the world, and very little serious side effects. And again, if you multiply that by many-fold times, it represents the number of vaccines in general that have been distributed. And the minimum reactions far outweigh the risk of getting the infectious diseases that these vaccines prevent, including COVID-19 vaccine has significantly helped decrease the amount of deaths among our elderly, among our seniors who have been disproportionately hit. And I can tell you that if you extrapolate it to other vaccines, pediatric vaccines that we are giving in the 2nd, 4th, 6th, 12th month of life and so on, these vaccines are really preventing very severe deadly diseases. And believe you me, I've been around long enough to be able to tell you that I have seen diseases that would be killing and maiming children literally back in the 1980s when I was starting to practice pediatrics. Thanks to certain vaccinations, we don't see those anymore. And so I think that when you look at it at the large scheme of things, the number of cases post-vaccination for a variety of illnesses, and not only the infections themselves, but also the complications of the severity of which has been significantly reduced by vaccines.
Thank you, Dr. Paul. And I think you've already touched a little bit on that, but we had a question come in from a registrant. And they ask, what are the risks and benefits of the vaccine for immune people?
The First of all, the benefits we know. The benefits really are to prevent severe disease. We would like to have a vaccine that prevent an infection 100%. Unfortunately, we don't have many like that. COVID vaccine has been shown to significantly decrease the burden and the even long-term sequelae, long-term complications, hospitalizations, admissions, outbreaks. All these things have been decreased, and the risks really are related to what we see in other vaccines, not any different in terms of some side effects of local infections, local site injection reactions, bit of fever, a bit of malaise, and so on. Rare side effects are quite rare. We know that myocarditis has been seen with certain vaccines, COVID vaccines in certain age groups, but I can tell you that the rate of myocarditis due to COVID infection itself is much higher than any of those minimal risks. And so we always have to look at the risk-benefit ratio. And again, not only with COVID, the risk-benefit ratio always favors vaccination, particularly among vulnerable populations.
Thank you. And the next question is, are Omicron bivalent boosters available and necessary for children under 5, and is it safe?
Okay. First of all, we know that the vaccines, again, approved from Health Canada, have gone through vigorous testing, and we know that in the United States they've given millions of doses in children under 5. There seems to be very little side effects from what we've seen, again, in the million of doses in pediatric COVID vaccination. And these vaccines, to me, are quite effective and targeted. And so I do believe that, like with other vaccinations, the risks are very minimal. As a matter of fact, we have a sense that even the mild side effects are less in young children as compared to older individuals, and the benefits are obviously tremendous. I want to stress as well that some people say about COVID, well, COVID doesn't really infect or cause severe disease in young children. In the most part, in the most situations, that is true, but we do have actually right now in Ontario, we have about 125 kids in the ICU, and a couple of those are COVID. So we can't say that COVID does not cause severe disease in young children. Obviously, the flu causes more severe disease. That's another issue that we're facing right now. But we do know that COVID can be dangerous in young children. And another reason to vaccinate young children as well is that the more people are vaccinated, the less the virus has an opportunity to circulate within the community, and the quicker we can get out of this pandemic. We're all fed up, aren't we?
Absolutely. And I think, we've, for the most part, we've been good with our vaccinations, and people have been taking booster shots. And the next question is around the need for boosters. A participant is asking, what is the need or benefit of additional boosters after the third booster?
Okay. What we know, so let me answer the question in two parts. We know that between the second and third booster, there's the second and third dose, there is a difference. We know that the protection against even Omicron is increased much higher with the booster dose as compared to just your second dose. And we also know that the protection against hospitalization is also increased. We also know that the duration of protection with every subsequent dose that you get actually increases. So the duration of 2 months is less, at the second dose duration of protection is not only lower, but less long than the subsequent dose. And we know that, for the most part, the doses last between 3 and 6 months. However, and I do know that other individuals have received 4 and 5 doses, that's more the elderly. And that's because, again, we know that with Omicron in particular, the vaccine effectiveness wears off with time. Well, there likely will be a time where we'll have an equilibrium where we'll likely have a yearly vaccine, for example. But again, this is the whole problem with an emerging virus. We don't know the patterns yet. We have not established what pattern of disease and infections it will cause. And so we're trying to look at it right now. But all I can tell you is that I just did a CBC interview before, and they were asking me, like, how was 2022? I can tell you that we started 2022 in late 2021 after a majority of the population had received the 2 doses. And we saw a dramatic decrease in cases, a real dramatic decrease in cases, a dramatic decrease in outbreaks, a dramatic decrease in deaths related to Omicron, to the virus. And then late in I would say November, December, we started getting rumblings about Omicron, a new variant that came out that seemed to be more resistant to the vaccine. And so we basically started getting people getting what we call breakthrough infections. In other words, probably 6 million people in Ontario got COVID despite being vaccinated, but most of them did not end up with severe disease, and it just went away on its own without any consequences. So, and then we got a second wave in April, and then moving forward, we don't have waves. We have little ripples that are going forward. So what we've done with that, what I call the wall of community immunity, combined people who have been infected, you have some protection, albeit short-lived, and hybrid addition, in other words, a different hybrid addition of vaccine protects us. And that's why today we're actually seeing relatively lower numbers, not wave-like numbers of COVID-19. COVID-19 is not what's overwhelming our healthcare system now, although it was back from 2020 and the various waves into this. And so it has done its job. And now with the reason we got these breakthrough infections is because the Omicron had changed to the point where the efficiency against preventing transmission, in other words, one person giving it to another, had decreased. That protection had decreased as compared to 80–90% with the Delta variant. And so a lot of people were getting it. But the good news is that there was still quite high protection against severe disease. Now, with the bivalent vaccine, we have the original strain in it, and we have the Omicron strain in it as well. And so we have a much better match of the circulating COVID. And so I expect we will be seeing not only continuing protection against severe disease with COVID, but also community transmission will be prevented at a much higher rate with the Omicron variant vaccine, bivalent one. And so that's why, moving forward, we're going to be vaccinating. It's not dissimilar, Zindu, to the flu vaccine. Every year, we have several strains in there, and we taper them depending on what's circulating. So now we know that Omicron is circulating, and now we're like we're saying is that, at some point, there will be enough worldwide immunity that it'll fizzle out. So hopefully next year we'll see a big turn. But at this point, we need to continue and be up to date, because we want to maintain that level of community immunity as much as we can.
So I guess years down the line, it will become as normal as a flu vaccine or other.
Yeah, what happens is with these viruses, and we've seen sort of historically, there was a virus that caused the Russian pandemic back in 1883, I think it was. It actually was COVID. It was a COVID type virus, coronavirus, that had the same pattern of infection and just became sort of the regular cold virus, flu virus, cold viruses. So yes, we're probably going to be looking again. We're going to learn as we go, because it's a new emerging virus, as to what type of yearly protection we might need. Again, and that's something, and that's what some people say, well, you guys don't know what you're doing because you keep changing your minds, you keep adding vaccines. Well, it's not that we're adding, it's just we don't have the experience and the knowledge of how the patterns will end up sort of in the world non-pandemic type of situations.
Thank you. And we do have a question from Gina from the audience. It's in French, but our team has translated using Google. So my apologies for any little inaccuracies. The question is, our agency has mandated the wearing of masks for employees and customers at work. What is your opinion on wearing a mask in our offices when we are alone and the door is closed, while leaving the window open for ventilation?
My opinion is, first of all, I congratulate them for doing that. Je vous félicite pour avoir fait votre mandat. Je pense que dans le contexte que vous avez des enfants, des personnes vulnérables chez vous, la protection, je pense que c'est votre rôle, votre responsabilité. Par contre, on the other hand, I just said it in French that I think it's very good that they've done that. But I think on the other hand, if you're like for example, if you're alone in your room or you're far away from somebody else, you don't need to mask. We're talking about masking in crowded indoor places or where you're with vulnerable populations. That's what we're doing right now. And so it's quite important that we just maintain that. And it's not important. It's not only important for COVID. As you know, right now, we've got, flu really high. We've got RSV that's quite high. That's disproportionately affecting young children. And so the mask is part of the layers of protection that we should be using. So any healthcare provider, any provider that provides services or is in contact with vulnerable populations should be wearing a mask. If they're in their office alone, and if they're physically distancing with other people there, obviously mask is not necessary. Obviously, don't go to work when you're sick. Practice frequent hand washing, practice disinfection, because we know that disinfection, particularly with RSV and flu, is important, because if somebody has the flu or has RSV and sneezes or coughs onto a surface, that virus could last for hours and hours. And so it's important. So if I go and touch that keyboard and touch my nose without washing my hands, without having disinfected it, I can infect myself. So that's why. So if you do those things together, you're protecting not only yourselves, but also your vulnerable population that you're treating.
Thank you. And just changing tack a little, I think, Dr. Paul, you've answered a lot this question, but I just wanted to say it because we had received it from the audience. What are the risks and benefits of children's vaccines? Is there something more that you would like to add to that?
Are we talking in general vaccines or because children's vaccines, I'm talking the 2, 4, 6 months, those vaccines, the risks are very minimal. I have been vaccinating myself. And like I said, billions and billions of children have been vaccinated worldwide against very dangerous diseases, diphtheria, polio, pertussis, Haemophilus influenza, meningitis, pneumococcus. Like these cause very severe disease. And I, as a pediatrician, have treated them. I, as a pediatrician, have told parents that your child has died of these diseases, and which we can now prevent. So there's some small risk. Whatever the risk is, it's a local infection. It is not really a serious one. For myself, the thousands of kids that I vaccinated and the millions and billions worldwide, the risks are very low, but the benefits are very, very important, because we are dealing, particularly if we're talking about childhood immunization, we're dealing with very, very serious diseases that are particularly dangerous to young children.
Thank you. And before we move on to some more questions that we had received pre-webinar, I'd like to open up the opportunity if anybody has something, any comments or questions you have for Dr. Paul. Feel free to keep adding to the chat if you would like, and we'll get to that for sure. The next question, Dr. Paul, we've had this question come up many times, especially in our sector, as people, deal with families on a day-to-day basis. How do we tackle vaccine fatigue between the boosters and the flu vaccine, especially now? Yeah.
Very good question, and really, I think that's very pertinent today. Particularly young children as well. Don't forget that we're vaccinating children in the first 2 years of life, literally every 2 months for the first 6 months, and then a couple of months after that, a couple of times after that. And so then you're talking about influenza, flu shot, you talk about COVID. So yes, there is a fatigue. And I think one of the things that we need to do is we need to acknowledge that first. We need to, I'm not going to disagree with a parent to tell them I'm sick and tired of my kid getting needles, my kids and, pin cushion, I've heard that all the time. And I agree with that. But on the other hand, unfortunately, I've been at the other side of receiving children or seeing children and treating children who have succumbed to or have had severe consequences with all these diseases that vaccines can prevent. And so I think it's important to understand that context and say, I know it's vaccine fatigue. Let's work together to create. It's not convenient for you. Like, let's go out of our way as healthcare providers to be compassionate, understand what and also reinforce, yeah, I agree with you. I agree with you, but, this is what their vaccines are for. This is what the benefits are, and this is what the risks are if you don't vaccinate your child. I think it's important, but you need to be compassionate and not judgmental. If you're judgmental, you're going to turn people off. And that's not what we want to do. We want to be compassionate and say, yeah, I understand. Let's talk about it. And the more you have a trust, like, for example, I give a lot of lectures on how to approach vaccine hesitancy, primary care providers, physicians. It's not different to others handling families, is that the more they know you and they trust you and they have that confidence in you, the more you'll be able to dissuade them from being vaccine hesitant and turn them to that. About 10 to 15% of the population are vaccine hesitant. Doesn't mean they're refusing vaccine. The ones that refuse vaccine pre-pandemic was about 1 or 2%. But the 10 to 15% that are in there, have more questions. Have issues, they have maybe perhaps misconceptions, that you can clarify. And you can say, okay, where'd you get that information? Well, I got it on Google. Like, what site was this? Well, it was a site that were selling vitamins instead. Like there are certain things that you should be looking at and sort of clarifying for them. But again, in a non-judgmental, supportive way. And the more they know you, the more they trust you, the more you'll be able to convince them.
I think that's such an important point, Dr. Paul, trust and the relationship, and to understand that we have each other's best interests at heart in having these conversations. And there's another question that's, I think, the other side of what we were just talking about. Somebody has asked, what reason would someone have for not getting vaccinations? Well, there are some people that are adamant against it. They don't believe in vaccines. They believe it's not natural. They believe it is contrary to their religion. There may be religious reasons, a whole slew of reasons. I don't want to put toxins in my body and all that. That's, I've heard all that. I think if you're looking at why wouldn't you be, there are very rare conditions and very rare types of vaccines that you may not be able to get because your immune system is weak, and so there are certain vaccines that we give that you shouldn't be getting. Or if you've had a very severe reaction to a certain vaccine, when I talk about a reaction, talk about an allergic reaction, because that's one of the risks, which are very low. But there really isn't. Aside from parents not wanting to be vaccinated, their kids want vaccinated, there really are very minimal medical conditions that say you can't be vaccinated at all. There may be certain situations where certain vaccines, your child may not be able to get because of certain conditions, but I've never seen a child that we can say, oh, this child cannot be vaccinated at all. That's really interesting. And we do have another question that could be a follow-up. I'll just read it off the screen here. It says, what have we learned on effective ways to build confidence among healthcare providers? And I guess we could stretch that also to any other kind of service providers. It is surprising to see the number of health professionals involved in disseminating or creating false narratives about vaccines and other science-related issues.
We have been frustrated pre-pandemic with the low uptake of flu vaccine among healthcare workers. We've been quite frustrated by that, in fact. And we were, in my health unit, and part of what we're doing as a surveillance, we were actually looking at rates of flu vaccine uptake among healthcare workers and in long-term care facilities, hospitals, and so on. And they were not what we wanted them to be. And so I find that quite ironic, that individuals who are taking care of people, who understand the science, don't want to get vaccinated, and particularly with the flu shot. And we've had some issues with COVID as well, but not that many. I'll be honest with you, if you look at the number of people that refuse to be vaccinated, it's minimal compared to the healthcare force that we've had. But again, there are some individuals that don't like vaccinations, and that's not part of science. Like, I as a physician and anybody else who's a healthcare provider needs to be able to communicating, valid science-based information, not their opinion. Their opinion should be based on science and references. And if they fail to do so, it is contrary to medical practice or nursing practice or any other restricted or regulated profession. So we have seen that. And so that is, to me, that is the issue. And again, I tell people, if you listen to somebody, and I know they might say, I'm a doctor. Okay, what kind of a doctor are you? Where's your license? There are certain things. Look at how credible is the individual. How credible are the references of these people that they're doing? But like I said, that's the minority. There's not that many healthcare providers that are doing that. Although we are seeing, like I said, higher rates than I would like, of people not wanting, like healthcare providers not wanting to get the flu vaccine yearly, for example.
Thank you, Dr. Paul. And we have another question from the audience. Phyllis is asking, can you address the benefit or risks associated with vaccine mix offered or available, I guess, right now?
So we're talking about, I presume, the Moderna and Pfizer COVID vaccines. That's what we're talking about right now, I presume. Because you have a choice of either getting Pfizer or Moderna. Initially we were sticklers about, if you got Pfizer, you got to get Pfizer as your next dose. But now we know that you can mix them safely. As a matter of fact, every year there are different flu shots that people get. There are different manufacturers of measles, mumps, rubella, and it doesn't really matter. So I don't think that there's an issue. It was because it was new, and that initially we didn't want to mix them, but mixing them does not cause any issues at all. And we tell people, particularly during pandemic and pandemic situations, get the vaccine that's offered to you and available to you at that moment.
Thank you. And there's another question here from our registrants. Like the flu shot, is getting the COVID vaccine once a year enough now?
At this point, I'm not sure. There might be a request for a rebooster early next year sometime. We might leave a 6-month period, but then we'll see. So the data will tell us at what point we will switch to a yearly, or if we need a yearly, or who will need a yearly. It may be that certain populations need a yearly one. I do know that there are companies now working on one shot that will contain COVID and flu, for example. But the answer is that we'll likely end up at an annual for certain populations, but I'm not sure when. My suspicion is that we're going to need another booster next year sometime.
And that brings me to the next question, actually. The question is, after you receive the booster, do I need to get another booster after a few months? Is that necessary?
Yeah, it is. At this point, I think that's what I'm talking about. I think that within a 3 to 6 month period, we need another one. And again, the older you are, the more you should be adhering to that, because we know that in elderly, the vaccines do not work as well as young. They don't last as long, and they don't work as well.
Thank you, Dr. Paul. We've received so many questions, and we've got through a lot. There's a lot more that we have here that we received pre-webinar. And as I'd just like to remind anyone, if you have a comment or question, please do use the chat box or raise your hand. But I'll continue with the questions that we received before. The next question is, what are some long-term effects of the pandemic and the vaccine that we are starting to see now?
Okay, so let's start with some of the long-term effects of COVID itself. We know that you can get long COVID, and long COVID is, okay, let's start back. COVID itself, the virus itself, is a very different respiratory virus. Because it mutated, and we think it came from an animal type of virus, it causes different reactions in the body. It actually causes our immune system to go crazy, to go into hypervigilance. And so that's why we have high rates of heart attacks, strokes, clots, blood clots, those type of things with COVID, with COVID infections. I want to be clear. So it's a different than what we see with other respiratory viruses. And that's why we see kidney failure as well, with initially when it started. So in addition to the severe respiratory illnesses, okay, so that's one thing. On the longer term, we do see people, particularly initially on, they have long-term lung sequelae, they have decreased respiratory capacity, they have a fog, like their brain has a fog, they don't feel very well. And there's a whole slew of post-COVID, like they call it post-COVID syndrome, we call it now, it's long COVID. And so that's what we're seeing with that, in addition to the acute deaths and all the other things that we're seeing. So that's the effect of COVID. That's the medical effect of COVID. The non-medical effect of COVID is that restrictions and all the social isolation, we pay a price from the mental health point of view, developmental point of view of children, school closures, all these things are detrimental. So there's a negative effect to all these things, but we had no choice to do them because we didn't have a vaccine or any treatment when it first came out. So those are kind of those effects. What are the effects of the vaccine and the risks of the vaccine? Well, we talked about the vaccines. Like I said, in terms of side effects, they're minimal. Severe ones, very rare. We have seen some more longer term effects, but not to the point where it's significant numbers, but we are keeping an eye on that. But I can tell you that there's benefit to that because it shows that the more vaccines one has, if one gets COVID, the less likely to have long COVID. So there are protective factors as well. So to summarize, there are direct medical effects of COVID infection. There are societal effects of COVID infection because of the isolation and the restrictions that were imposed. And there are some minimal risks with the vaccine, but there are multiple benefits of the vaccine as well, particularly when it comes to preventing some of COVID in the first place and its complications and severity, and long COVID as well. That's another important one.
Thank you, Dr. Paul. And just going back to what we had been talking about before regarding boosters, we have a question here from John. What is the waiting period to get a booster after you've had COVID?
It's 3 months. I want to explain that as well. Coronaviruses are very poorly immunogenic. That means that when you get infected by a coronavirus, of which COVID is one, your body remembers it only for a couple of months, and it doesn't induce longer-term immunity. So we know that once you've got COVID, you're protected for at least 3-4 months, but then you can get it again. So we would recommend getting a booster 3 months after your infection of COVID.
Thank you. So, a lot of people that wanted to come to this webinar from our members, family support centers and family support workers. So one of the questions is, what can family support centers continue to do to encourage vaccination without isolating individuals with strong anti-vax sentiments?
Again, it has to do with trust, as we talked about it a bit before. It kind of spills over from the previous question you asked me, Zindu. I think it has to, and in particular, you need to understand particularly cultural, linguistic, socioeconomic context. All those things have to play a role. And some of them may be hindrances to be able to communicate. Some of them maybe you can take advantage of those. There's a few things that you need to do. But again, non-confrontational, non-judgmental, trustworthy patient approach should be there. Condescending, being combative and being authoritative does not work. And so you need to sort of be supportive and be prepared to answer any questions and perhaps rectify any misinformation that they may bring to the table as well. And again, it all depends on, and a lot of those things may be complicated by barriers, linguistic barriers, cultural barriers, poverty, socioeconomic barriers. There's a whole slew of things. And that's where in public health, we need to look at those. And that's why we know that there's a disproportionate amount of disease among particularly high-risk populations, many of which are being followed by your members. And so it's important to take that into account and not to forget that, that individual does not want to get vaccinated because they don't have a car to go get vaccinated. That's a simple one, but you need to understand the whole socio-cultural context that you're dealing with.
And along similar lines, what about when a colleague is promoting anti-vax sentiments?
Well, I think it behooves the organization to take action. I think that if I'm a director and one of my staff are promoting it within the context of my work, that has to be addressed. I would have zero tolerance for that in my organization.
A few more questions about the vaccine itself, so we can talk about again boosters and COVID vaccine. Is the vaccine even working if I need a booster? It's one of the questions. So
yes, it is. Yes, it is working. We have evidence, scientifically based evidence, and I don't have the graphs with me, but I can show you that whenever we have higher rates of vaccination, boom, you get a much decrease, and we have efficiencies. The vaccine, like I said, unfortunately, the vaccine does not work as well with Omicron. That was the problem with the original version of the vaccine, not the fault of the vaccine. It was because when we initially vaccinated people, 80–90%, second dose, we had higher rates of community immunity. But then Omicron came in and started becoming resistant to that, but not resistant to the protection against severe disease. Right now, we've now tweaked the vaccine and now have an Omicron variant in the vaccine, which will not only sustain and augment your protection against severe disease, but it will also protect you from getting it if you're vaccinated, unlike the previous version, which did not address Omicron directly. And so it's not the vaccine's fault, it's the virus's fault, so to speak, because viruses do change and evolve, right? What a virus wants to do, they have nothing to lose. They want to go infect you and then infect others. If they don't have people to infect, they can't live. I lost you.
Sorry, I was on mute. Sorry, Dr. Paul. As you mentioned in the beginning, earlier on, Dr. Paul, we are seeing a lot of flu and respiratory cases given the season. And one of the questions is, with the sudden increase in flu and respiratory illness, will this increase the impact of COVID-19?
That's a very good question. There are three kind of threats, viral threats right now, unlike what we had a couple of years ago, which was only COVID, right? So right now we have COVID, which fortunately, because of the community immunity wall that I talked about, is at lower levels. It's not in a wave at all. It's really flat across Canada, and it's not overwhelming our hospitals, okay? What is overwhelming our hospitals right now is flu and RSV, respiratory syncytial virus. And we've had unprecedented numbers and earlier onset of influenza A, particularly among young children. Okay, that's not happened before. So our ICUs, our pediatric ICUs across Canada are overwhelmed by an unprecedented pressure on them because children have been getting the flu and or RSV, respiratory syncytial virus, which causes asthma-like very severe symptoms in young babies. So that's what we're seeing. Fortunately, COVID has been, because of our protection, our immunity protection is there. It doesn't mean that because we have flu, we're going to get COVID. It doesn't mean that. Of course, if you get everything together, it's the worst scenario. And yes, we have some kids that have had flu and COVID at the same time, very rare. But it's not a matter of, COVID will come up because flu is there. It's just a matter of the timing. And that's our goal. Our goal is to be able to limit any simultaneous rise of any of those three at the same time. Unfortunately, we had a simultaneous rise of RSV and influenza that caused the current issue, but we didn't have but fortunately, COVID was flat. If we had had COVID at the same time, it would have been a much bigger impact on our healthcare system, which is already at unprecedented levels of pressure. So it's not that it's going to be like it's related that way; they're indirectly related, and that's why I always talk about what we can do collectively to decrease all those things that are circulating that have come earlier than usual. So their first job is to continue muffling and decreasing as much as we can, dampening COVID. That is achieved by getting your COVID being up to date with your COVID boosters. The other thing that we want to do is we want to mitigate RSV, which we can't. There's not much we can do. There are some vaccines for very high-risk children, but they're not really available for everybody. So there you need to be able to have your public health measures. And for the flu, what we can do is we do have vaccines, which are available for children 6 months and older. And this has been shown, this current epidemic of the flu has shown that the flu is very dangerous to young children, and people did not appreciate that or forgot that. As I said before, COVID, for the most part, does not cause severe infections in children. And so people extrapolate that and say, it's like a cold, child will get a flu, it'll go away. Unfortunately, that's not true. We do know that the two age spectrums, the 0 to 5 and the 65 plus, are the most at high risk of the flu. And they're the ones that are now in hospital right now, those two age groups. Fortunately, in Ontario, we're starting to see a bit of a decrease now in hospitalizations and admissions, but we're still at unprecedented levels. I think that's because RSV is flattening, and we're seeing a bit of a flattening of the influenza. So what we want to do, so again, to keep everything at bay, continue with our COVID. Now, we've talked about vaccines because 2 out of the 3 circulating viruses we can prevent severe disease with a vaccine. So let's get that done. But in addition, we need another layer of protection against the ones that are not vaccinatable, RSV, for example, and the other viruses that cause colds. Those we need to collectively wash our hands regularly, disinfect the surfaces, wear masks in indoor crowded places, like I said before. Don't go out when you're sick. Be logical about it. The more we do that, the more we'll be able to take the pressure off on our healthcare system and prevent any simultaneous triple threat, because this is a triple threat. Fortunately, 2 out of the 3 rose, not the third one, which was COVID, fortunately. And in order for us to keep it that way, we need to continue these into the next couple of months. I believe that we're going to start seeing a downturn, and hopefully over the next couple of weeks, it'll be more manageable. But in order for us to continue, we need to, again, make sure our vaccinations are up to date, COVID, flu, but very importantly, those other layers of protection will also help all those public health measures. Very important.
Thank you so much. And you've touched on many of the questions that we already got. People were asking, the vaccines have been approved for children, but are they really necessary? And also some concern around why so many children are in hospital, and whether this is because of a new variant of COVID-19.
No, I want to clarify. Right now, I just saw the data in Ontario. There's about 115 children in ICU in Ontario. 3 are COVID. Mm-hmm. Okay, the remainder are RSV and influenza. And so this is not due to this current issue that we're seeing is unprecedented. And this current rise in pediatric admissions is unprecedented. We did not see it with COVID, and this is not COVID related. I want to make it clear. It is not COVID related. It is due to the flu and RSV. Okay. And so that's why we're trying to remind parents and families, please get your flu shot as well. And it's not, and I'm not saying you shouldn't get your COVID shot, but you get both, is what I'm saying.
Great. That makes it very clear, because I know that, parents have been really worried about this, the news that we are hearing about all the children affected.
Yes, and unfortunately, like I said, it's not news to me or to my colleagues that influenza can cause severe illness in young children, even death. We had a death in Eastern Ontario a couple of weeks ago, unfortunately, a flu, a young child. And so our message, and as a matter of fact, I've been on radio and TV the last couple of days with that, reminding people that the flu is not just a cold. The flu can cause severe disease in young children and in the elderly as well. That everybody knows, but they forget that it causes severe disease in the young children, and that we do have a vaccine, and we have a vaccine that matches the circulating viruses that will be effective against preventing in preventing severe disease, particularly amongst the young children.
Thank you, Dr. Paul. And that I have a final couple of questions left.
Sure.
So this is really looking at the future. And the question is maybe two parts. One is, with masks no longer required in most establishments, is this a good sign for the future? And how do you think the situation will look in 1 year's time?
I believe the situation will be better in 1 year's time. I believe that, however, we will always have bouts of influenza and respiratory illnesses. I would like to see masks being used routinely. When there's high levels in the community, people could make it a habit. I mean, no, I'm not talking about mandating it. I'm just talking about, we're not mandating washing your hands. We're not mandating sneezing into your sleeves. Just make it into a habit. Disinfection. I think that should be part of it. I don't think that it'll be necessary to do it all the time, obviously, or every season, but just be aware that that would be perhaps another layer of protection that we can use on a voluntary basis, to be able to help the community. But certainly the tenets of our infection prevention, washing your hands and all that are going to be there all the time. Whether or not we need yearly COVID vaccines, I'm not sure, but I can tell you that these respiratory viruses in general ain't going to go away. They come every year. So we need to just understand them better and know what we can do about them.
Dr. Paul, we have one more question from Gina. We're coming up to time, but this is a good question, I think. A lot of misconceptions around children getting sick and being hospitalized. What is your opinion about some of these thoughts around children not being able to build their immune system because of the mask mandates?
Absolutely not true. I don't agree with that at all. The mask did not affect their immune system at all. Did not affect anything. I believe the restrictions in the schools, caused some issues in terms of development and learning and academic, but I do not believe that it caused any immune or any issues. I can also tell you that, people are saying, well, you need to be exposed to it so you can, build your immune system. I can tell you that if I infect a 2-month-old gets infected with, meningitis bacteria or whatever, and that baby may die, and that is not a way to improve that, mature that baby's immune system. I'd rather the baby's immune system be primed by the vaccine, which stimulates the production of antibodies. So in other words, I don't believe that, because, they call it the immune theory. I know there's a lot of theories going around. I do not believe that's valid. I believe that the children, of course, as you get older, and I can tell you that, as a pediatrician, I can tell you that kids who go to the daycare, I'm not talking non-pandemic, kids who go to the daycare get 14 colds or grippe or viral illnesses a year. And that's natural, and that builds up their immunity and so on. But I'm not talking about them getting meningitis or getting, epiglottitis or getting polio or getting pertussis. I'm not talking about that. I'm talking about the natural cold. That's different. Then their body gets used to it. I'm talking about severe diseases that we're vaccinating against.
Thank you. One more question. Do you think the COVID vaccine will become an annual thing, like the flu shot?
I suspect that's where we're heading. I'm not sure what the timing will be. Will it be next year? I'm not sure. It may, like I said, it may be annual, or it may be annual for certain populations, like, for example, the seniors or people with underlying medical conditions. So that would likely be where we'll end up. I know that next year there'll be requirement at some point. I'm not sure when, likely in the spring, I'm not sure. However, the important thing is that, we're going to keep an eye on it and keep the surveillance and see where we are with that. And as I said before, I know that already there are companies that are developing a joint vaccine that contains RSV. Actually, they are making an RSV vaccine as well. But in this one, they're actually looking at a vaccine that has flu and COVID in it that will be given annually. So they're preparing for it. Again, not sure when that will be done, likely, and I'm not sure to which populations. If I was a betting man, I would say likely to the higher risk populations.
Thank you, Dr. Paul. So we are almost at time, and you've shared a lot of facts and dispelled a lot of myths. I wasn't able to get through all the questions, but most of it for sure, given the time. Is there anything you would like to share before we close?
Well, yes, I would like to, again, first of all, I want to thank the community across Canada, really, for adhering to and supporting our efforts. From the beginning of the pandemic, we asked a lot of people. We closed things down. We asked a lot from businesses. I recognize businesses suffered, people's income suffered, livelihood suffered. We do recognize that. I want people to understand, and that we don't take that very lightly as well. So, and we're not going to forget that post-pandemic. That's one thing. But I do want to thank people for indulging with all of these restrictions that we had to do, and also for rolling up their sleeves. I mean, we had an unprecedented amount. Canada is one of the world leaders in numbers of vaccinations, and if you look at our death rate compared to other countries, the United States has 1 million deaths. We had much less, comparatively speaking, per capita. And so I think United States and Brazil were among the top in the world, and they're the ones that didn't have high vaccination rates voluntarily and so on. So I think we've done an excellent job in Canada. I think our patience is running out, and I appreciate that. But I think we're at the tail end now. It's been complicated now by the fact that the flu has come early and RSV has come early. But again, if we can sort of look at a community mindset, not only to protect ourselves and protect our community and people around, and vulnerable people around us, that we'll get out of this as quick as possible and move forward over the next couple of months, because we are worried about once you go indoors in cold weather, that these viruses will flourish. And the more we can collectively get together and practice all of these measures that I talked about, the better we'll be able to manage these things moving forward.
Thank you so much, Dr. Paul. Thank you again for your time and for sharing all your expertise. I'd also like to take the opportunity to thank you and your team for this non-stop work that you've done over the last now 2.5 years to keep us all safe and to share all the knowledge. Thank you all to the people who participated today, and to our sector as well, who are really on the front lines in supporting families get through every day in all the challenges that we have